So, John, the message is a counterintuitive one.
Yes.
The umbrella of healthcare, though, probably provides a lot more coverage. You're talking about, in many cases, preventative healthcare or basic healthcare, where people don't want to do a lot of things. You're not referring to acute healthcare as much, or are you referring to acute healthcare as much?
Well, I think acute is obviously, actually in acute healthcare, essentially you can't shop.
Right.
You have to make a decision right away. I think on hospitals, it's also unfortunately similar. Most people don't shop hospitals. Mostly they go to hospitals where the physician tells them to go. There are some brand hospitals that people will go to. But in general, people don't shop hospitals either, good hospitals.
So even if there's transparency, even if it all occurs on the web, do you think that there will be more of this naturally if the data were easy to get, easy to find, easy to compare? Or is it really human nature says, I don't really care how easy it is, I just want the donuts?
Well, I'll give you one example. In New York State, we've had cardiac surgery mortality data reporting for close to 30 years by surgeon and by hospital. An incredible risk analysis model based on 20 factors. I, to date, know of anybody who's gone online, used that information to pick out a cardiac surgeon and or a hospital that has a lower mortality to go to.
So we're dealing with human nature at the base level here.
Right.
So, go ahead.
Well, the human nature issue is I tell people all the time, people are driven by two things. One, desire, and two is fear, especially fear of pain, and that's what Freud said. So people they're afraid. They don't understand it. They just don't want to have the conversation, and actually going to a doctor and a hospital is no fun.
So one last question that came in from TEDMED Live. High deductible plans with money in health accounts. That means they have their money sitting outside, it's waiting to be used on something.
Correct.
Those people, but if there's a high deductible, say, let me just save it for a rainy day, I won't get the mammogram, I won't buy the basic thing. They have worse health outcomes.
That's absolutely correct.
That says it all. John, thank you very much.
Thank you.